today. I, wel- I welcome you all to day 5, third session. Our speaker for today is Dr. Nimmi Rastogi. She's the chief obstetrician and gynecologist. Ma'am is going to talk on the topic hormone induced stress, boon or bane, stress a double-edged sword. Before ma'am starts her lecture, I welcome you all and I welcome ma'am on behalf of Atma Sanatan College and Ramanujan College and our team, our Honorable Principal, Professor Gyantosh Kumar Jha, our IQAC in charge, Professor Vinita Tuli, and our team, Anjali ji, and the entire team to this 2 weeks online interdisciplinary refresher course. The topic of this refresher course is Holistic Empowerment for Stress Management, a multidisciplinary approach integrating literature, arts, social sciences, and medicine. This session is the fifth day, third session. Today, in this session, we have Dr. Nimmi Rastogi. She's going to talk, like I said, on the topic hormone induced stress, boon or bane, stress, a double edged sword. I am really glad and I'm so happy to introduce you to Dr. Nimmi Rastogi. She is not just a medical person, but I would say a medical person with a social conscious and a social responsibility too. Uh, Before I introduce you to her work and her profile, I'd like to say that Dr. Nimmi is not just a MBBS doctor or a specialist in her field, but she is a doctor with a human touch and a concerned attitude. So that makes her different from the others in her own fraternity. Dr. Nimmi is a chief obstetrician and gynecologist, like I said, and she's the owner of Sarthak Medical Centre. She's been the advisor to Health Planning and Policy, Government of Delhi. She's been the head of Rogi Kalyan Samiti at Madan Mohan Hospital, Delhi. She has been the advisor, Public Health Government of Delhi. She's been the ex-director, Mohalla Clinic and Swasthya Mitra. She has been on the advisory on community health and EWS well-being. Also on international forum, she is on the WHO advisory for research on vector-borne diseases. Dr. Nimmi has been on the governing council of Delhi University, and she's also uh, the ex-coordinator of the state COVID task force. And I have personally seen her work meticulously and with so much of hard work during the COVID task force. She's a spokesperson and state president of author of the best-selling book on Amazon. You can see, dear participants, these two books. She's a corporate speaker on women health and wellness also. Dr. Nimmi has authored these two wonderfully bestseller books. One of her book is From the Chambers of a South Delhi Gynecologist, and the other is Ruptured Boundaries, the Womb of Real Life Encounters. Dr. Nimmi is also started a YouTube channel, and she has some very interesting stories to share on this YouTube channel, and I have seen some of them. They are very touching, and they are very learning experience. She calls this channel the Doctor Who Tells Stories. So we are so glad that we have a doctor who's going to tell us stories, who will guide us, and who will enhance our knowledge about the topic that we are discussing. I'm going to just in words of Dr. Nimmi only before she starts. I'm going to say that she says that the plots are inspired by my experience as a doctor. So she talks about her own experience as a doctor and she shares it. डॉक्टर रस्तोगी की किताब के प्रोलोग से ही मैं थोड़ा सा कुछ पढ़ूंगी आप लोग के साथ ही शेयर करना चाहूंगी विद परमिशन ऑफ डॉक्टर निम्मी. डॉक्टर निम्मी का जो प्रोलोग है किताब का मैं आई एम जस्ट गोइंग टू रीड इट आउट टू यू फ्रेंड्स. Given a chance, would you choose the same profession in your next birth? Someone asked, casually, of course. Nodding my head, I chuckled. Gladly so. It's fun to be a woman's doctor. Also, for the sake of continuity, if such a thing exists. So the moment passed out, echo of frivolity persisted for days. After that, leaving me with lot to ruminate. The flashes of highs and lows of my career as a gynecologist kept haunting me as if to neutralize the vacuity of the claim I had made. I'm going to read the second part of this prologue at the end of the lecture. So, Dr. Nimmi, we welcome you and thank you for coming here and taking time out, because I know you have OTs and you have your patients. Thank you for coming and being part of this. And we are really honored to have you. And thank you once again. So I uh, welcome you. Please.
Thank you. Thank you, Dr. Mubin. Thank you, the entire team of ARST and anybody who's behind this wonderful course, the course that, that actually emphasizes on a very important subject. Had I been student, I would have joined myself. Having said that, thank you also for those generous words. I'm not as good as it appears, but yes, the field that I've chosen exposes me to all kinds of drama and all kinds of highs and lows, and I'm very happy to share it with you scientifically as well as in the fictionalized version of the story behind the scene.
Dr. Nimi, if I just add one more thing, the participants here are eager to hear from you because they are all university professors here. And one more thing I just want to add to you is that I think your lecture is one important lecture, because till now we've been talking about mental wellness, stress free, but physiological and the hormonal aspect that you're going to talk about, I think I just missed on that, so I thought I should add. Thank you so much. Sorry. Thank you.
Right. Thanks again, Dr. Mubin. So my field is that of obstetrics and gynecology. So I'll be speaking about stress in women. And men, please excuse because that's not my area. But yeah, there are some overlapping zones. So anybody and everybody who's listening to me can essentially look it from a woman's lens, because I'll be talking about hormones in a woman's physiology that lead to the stress, which is a double-edged sword. It is both a boon and a bane. And I'll tell you I will go in a descriptive form in an interesting way without making it a boring subject. So let's first cover the basics. I'm sure today being the fourth day, you must have already understood
Fifth.
the pathophysiology, or what is stress, why the stress is caused, and what happens when the stress takes a toll on you, and how to manage it. But I'll be telling you that the hormones that a woman's body necessarily produces to function in a normal feminine body, that is a good stress. And now you'll ask me, what is a good stress? Yes, stress has certain very integral function. So I very jokingly sometimes say that stress is the garbage that we all generate, but we sometimes forget to clear it. Stress is a necessary evil. It is a double-edged sword. Stress doesn't happen to us. We happen to stress. So the thing is that whenever we are faced with a challenging situation, it is in our DNA to respond in a manner so that you can cope up with that challenge. Our body has certain ingrained uh, mechanism which makes us react to a challenging situation. When you go overboard, like you sense a challenging situation and you go overboard in protecting yourself, that is when the anxiety is generated. Some amount of anxiety is also good, but excessive anxiety, chronic stress, day in, day out for years, that of course is bad for our body, for our mind, and also for our soul. So a woman is born with one uterus, two ovaries, two fallopian tubes, and the entire reproductive system is totally governed from here. Yeah, I mean, the uterus doesn't have a mind of its own, but the human has a mind which has certain endocrine glands which produces certain hormones, And then that leads to normal physiology, like getting periods every month is totally an endocrine process. Producing egg to fertilize and to get pregnant is completely governed by hormones. Lactation is completely governed by hormones. PMS, all kinds of mood swings, everything is governed by hormones, which is the fallout of normal physiological function. So there is this hypothalamic pituitary axis that gets activated and certain hormones are released, which sometimes side effect of that could be water retention, feeling anxious, fight or flight kind of response subconsciously. You don't know. There have been cases of PMS where a woman has committed murder to that extent. So it becomes like a psychiatric illness which started like an innocuous reaction to certain hormone called progesterone, leading to water retention, pain in breast, all kinds of funny thought, गुस्सा आ रहा है, सर दर्द हो रहा है, and this is a stress again. But what will you do when the stress compounds and a woman enters into the pathology of stress? And yeah, so such bizarre incidents have also happened. I wrote a story in which a person, a mother who's just born a kid under the influence of hormones, she tries to suffocate the baby. Now, this all sounds very dramatic. So, there's something called postnatal depression. Postnatal depression is also some sort of stress, which is, most people experience, but then it gets over.
Dr. Nimi,
Because,
I'm sorry to interrupt you. I think you need to just come a little closer to the mic. I'm so sorry. Yeah. Okay.
so I was just
Thank you.
giving examples for
Yes,
my viewers
that's
to understand the stress which is induced by hormones which are required for normal physiological functions in a woman's body, like periods, like pregnancy, lactation, menopause. We jokingly say कि बुढ़ापा आ गया, menopause हो गया. This woman has become irritated because she's old. No, but her estrogens are withdrawn, and that is leading to some kind of stress and whole lot of other things, and she is actually a victim of those hormones. It's the stress induced by those hormones which is playing on her psyche. So there are n number of examples, sometimes bizarre, extreme of the spectrum, but mostly you cannot imagine life without the hormones. So therefore, stress comes like a byproduct. You have to accept hormones, you have to embrace stress also. And the other day, I was enumerating the good aspect of stress. So, the other person, the patient sitting across, he says, stress के भी कोई अच्छे फायदे होते हैं. I said, why not? It keeps you on tenterhooks. It keeps you motivated. It gives you creative ideas. It doesn't let you sleep till the time your dreams are materialized. It makes you little bit of obsessive, which is very very good in the competitive world. But you should know how to keep it at bay so that it serves its good purpose and does not go overboard, so that you become a victim of chronic stress. But to begin with, let's go with the basics. As I've already said, it's a double-edged sword. Yes, it is. We can't manage life without the hormones, so stress will happen whether or not you want it or not. The other thing is the continuity of life. How will a follicle mature into an egg which eventually leads to fertilization and formation of a baby if there were no hormones? And if there are hormones, they will bring with it water retention, little bit of stress hormone release, little bit of adrenaline rush, your heart pounds, your BP shoots up. All these things are a gamut of a normal physiology, which most likely we manage uh, with good disciplined life. But when it goes overboard, when the normal physiology turns into pathology, that is where the red signal lies. So let's see what are the negative side effects, I mean, negative effects of stress. Before that, let me enumerate the number of hormones that a woman's body produces for these essential functions. So, estrogen, everybody knows, progesterone, then prolactin, then testosterone, dihydroepiandrosterone, thyroid stimulating hormone, adrenaline, cortisol. All these hormones, some of them are produced both in males and females, but even estrogen is produced in males, but in a very small quantity. Just like testosterone is male hormone, but it is produced in females in very small quantity. So the interplay of these hormones lead to normal physiological functions to get this, uh, the continuity to go on to get the life move on. The positive aspects I've already enumerated. Stress motivates, energizes. It also enhances our focus. You see a person who has no stress, no hurry to complete a task, vis-a-vis someone who has a little bit of stress hormones in his or her circulation, and his focus is different than the focus of somebody who's very laid back, does not want to finish the job. His focus is very diffuse, his productivity is not as great. Then we always say that to achieve something extraordinary, the person has to be a little bit of obsessive and compulsive. I mean, that's a joke in the medical fraternity that if you're an OCD, okay, then you are a type A personality, or you could be a type A personality. We need such people in our team because they are
Dr. Nimmi, I think your audio is off. Please, शायद आपका audio बंद हो गया. Yeah, can you start from that obsessive thing? I think we missed the obsessive uh,
yeah.
person on your team. Yeah, we
So
missed
we
from there.
jokingly say in our medical fraternity that uh, to complete a project, please bring somebody with OCD mild, because OCD person will be obsessive and compulsive, and that is a person who will be able to finish the job, finish the project, and will bring out a document or a project, something which is extraordinary. I mean, all this is jokingly said, but it has logic. People who have no stress, not at all right, they are in a privileged situation, they are safeguarding their health. But people with slight amount of stress hormones, little bit of obsession, little bit of cortisol level high, they may be harming their body in the long term if they don't know how to manage their stress, but they are able to perform well. And I could be saying it radically, but take it with a pinch of salt that this aspect is also true. Then the negative, negative aspects of stress are aplenty. Of course, it takes a toll on you. It makes your heart pound faster, blood pressure goes up. You're prone to high heart diseases, cardiovascular accidents, cerebrovascular accidents like stroke, etc. So, chronic stress leads to anxiety, depression, and all kinds of psychiatric ailments. If the person is already genetically prone to such psychiatric disorder, then that person should essentially be managing the stress very well, because he or she is sitting on the fringe. Uh, if you are not genetically predisposed, rest assured you will not turn into a pathological psychiatric patient. It's just you can use little bit of stress to your advantage and finish your goals. Well, there have been studies after studies that malignancy, metabolic disorders, even obesity and PCOD, all kinds of these things have stress as the contributory factor. So stress is the new cuss word in our medical terminology, and it is such an overused word, so that people start thinking that this is the enemy. I'm only here to make you see the other side of the story, because these chemicals, these little chemicals called hormones, they bring stress as an inevitable part of their effect on the body. So, say for instance, a woman has given birth to a baby, right? The nature itself produces prolactin in her body. I mean, her body is designed like this, that there is prolactin release, there is all kinds of other hormones release that leads to production of milk, right? She also has this protective uh, instinct that somebody is not harming my baby, that baby kahin gir na jaye bed se, yeah, baby should not be hungry. So these are innate internal maternal instincts that we call it in the layperson's language, but they're all hormone governed, right? Just come to think of it, if this goes wrong, a woman has so much of prolactin, and the estrogen is now slipping away because the pregnancy is over. So her body is used to that kind of high estrogen. When the estrogen is taken away, she enters into a phase called postnatal depression. She cries, does not take care of the baby. She thinks that the baby is her enemy. She can even kill the baby. She can she can stop caring for the baby. So you see the two phenomena. Something which is meant by the nature for protection of the new offspring goes horribly wrong. So in medicine, when we see the spectrum of, from this range to other range, we mostly talk about the extreme cases, but 99% of cases are within the normal range, wherein it comes and goes. The body itself heals. The PMS comes, PMS goes. But if the PMS continues for entire month, then it is pathological. If there is no PMS, maybe the hormones are deficient and she may have other problems. Like she may not be fertile or may not be producing eggs, or she may be having early menopause or premature ovarian failure, PMOF. These days it's very common. So we should thank our stars that our body is producing enough hormones, and we are experiencing these phasic physiological stress, which is actually a byproduct of those normal physiological functions. Having said that, um, I also would want to tell you that some people take oral contraceptive pills or emergency contraceptive pills. Some people take some hormones to stay young. Anything which is not required by your body, but you're abusing it by taking it without proper medical consultation for not its biological function or physiological function, for some other kind of functions, like estrogen and progesterone. A woman is menopausal, all right, so her periods get over, she gets irritated, she has hot flashes, she has dry vagina, she has difficulty in sexual intercourse, she all sorts of symptoms, but they come and they go. But if you start HRT, which is like we give you hormones from outside, mostly it is normal. If you are under supervision, you're taking HRT after your menopause, it's okay. But sometimes that HRT also goes horribly wrong. It may lead to overstimulation of the endometrium and can cause cancer. So everything has its pitfalls. You should understand the physiology, and if you don't understand the physiology, you can always take the help of somebody who knows these functions. So the key is to stay updated, stay aware. If you're experiencing stress which is beyond you to manage, please seek professional help, and most importantly, live a disciplined life. There is no parallel to a good, healthy life choices that will keep all the problems at bay. A good nutritious diet, good habits, as in getting up on time, going to the washroom on time, sleeping on time, not exposing yourself to screen excessively, and not eating too much of salty, processed, ultra processed food, especially in the premenstrual phase, because that leads to more bloating, more PMS. And likewise, physical activity. There is nothing as important as physical activity. Sitting is the new poison. Physical activity, as simple as taking a stroll for 15 minutes, could be your biggest stress buster, especially during physiological stages like menstrual period, or even before, while you're pregnant. These days, we promote active lifestyle in menstrual period. Those days are gone when our dadis and nanis used to say ki ghar baitho, rest for a day. No, please go out, even play sports. uh, the more mobile you are, the more active you are, the less problems of periods like pain, bloating, irritability is there. So, any sort of physical activity is good to manage stress. Hydration is such an understated thing. सबको पता है, but how many of us drink 3.5, 4 liters of water? Water is such a magic remedy. So I'm not saying something which is, something which is not known to most of you, but I'm putting the things in perspective that one, just change your perception towards stress. Some amount of stress is inevitable, so accept it. Only know the red flags when it goes overboard and it starts affecting your daily life. Seek help, live a healthy life, and if it is still not controlled, there are specialized ways like medication and some tools. Meditation is, I mean, medication and meditation, these are two different things. We give medicines to combat stress. Not always. I mean, very, very rarely I need to prescribe medicines for PMS or for postnatal depression, because I know body will heal itself. Just a bit of assurance will take a person long way. So that's all I had to say. Healthy living has the greatest of advantages. You needn't go to a doctor if you can take stock of your own health by living a disciplined, healthy life. Thank you.
Thank you, Dr. Nimi. I think I'll just we can open the we can enable the chat box for questions because
Sure,
uh,
ma'am.
just a minute. I would request the participants to share their questions, their queries. Uh, I have some um, somebody's it's on. Please shut it because my voice will echo. It will disturb. Okay, Dr. Nimi, I because I know you. Uh, People should watch your YouTube channel that you're coming out with stories. They're all real life stories. Your experiences with your as a doctor, as a gynecologist, where you talk about unusual real life cases in the form of stories and vivid description as it has happened, by keeping the identity and etc. You're not revealing that. My There's one thing that I want to know, since you're also associated on social perspective of women health and policy decisions of regarding women health programs. There's this thing going on. This debate going on about menstrual leave. Should women be granted menstrual leave? Because this is a big debate that has going on. We are at a stage that we've kind of lived our life, and but with changing lifestyle, with changing way of commuting, etc. There's so many aspects, minute aspects. I need not go into that. But as an experienced gynecologist and also a socially conscious doctor that I choose to call you, what do you think about this? Because that's also related to to us as working women.
My answer is no, Mubin. No, there's no need for any menstrual leave because menstruation is a
Yes,
normal physiological process.
yes,
It does not disadvantage you from any angle unless you are extremely anemic or you're having severe endometriosis, uh, all those pathological aspects. But there is no need. I've just said that mobility and is actually an antidote to all kinds of menstrual problems. And if we start taking leave, I mean, where is the time left to work? Some people have periods every 22 days, 23 days. So if we grant leave, I mean, I don't see where is the productivity left. In fact, a woman's body is very resilient. If I tell you the truth, when I was working in nursery as an post delivery where the babies are kept, so if it's a small embryo, say about premature embryo, we used to bet amongst students. If it is a female embryo, it is bound to survive. If it's a male embryo, say about 29, 30 weeks, total pregnancy is 40 weeks. Premature male embryos are weak. Premature female embryos, right from the beginning, they are strong enough to survive. So a woman's body is highly resilient. It is made that way. These are physiological functions. No need to take any leave. In fact, I radically am even against this 6 months leave after delivery. But from the baby's perspective, fine, it's okay. But a woman needs early mobilization. We make our cesarean patients stand the second day, say, move around, your recovery will be better. No need to lie in bed. Even these days, for spinal injuries and slip discs, etc., we encourage early mobility, early mobilization. So, vitamin M, which is mobility, is a new vitamin now.
that's very nicely and beautifully put. And I think अगर हम औरत को शक्ति का रूप मानते हैं तो किसी वजह से मानते हैं. That is, no, you have given us a physiological proof also, and physiological support also to that belief. And people who consider women as a weaker sex is also not right. So when it comes to stress management, there's a question. I'll just read it out, Nimiji. Uh, this is a question by Charu Ved. And participants, if any one of you want to directly ask Dr. Nimmi, I'll unmute you. So please just mention in the chat box. I'll unmute you. So Charu Veggie is saying, if stress is all about hormonal imbalance, then is the best stress buster just a matter of pharmacological innovation? If stress is all about hormonal imbalance, then is the best stress buster just a matter of pharmacological innovation? I
No, no,
think,
no, no.
no.
No,
Yeah,
I
ji.
understood the question. So it this was
Okay.
only the physiological stress that I was talking about. There are so many aspects of stress, the pathological stress, non-hormonal stress. So this is only a small segment that I'm addressing to. And yes, if hormonal stress has actually paralyzed your life, then you can take some medicines. Pharmacology helps. Some medicines are there which can taken basically for 2 to 3 days and you'll be fine. So, but long term stay of management of stress is lifestyle modification and learning some good habits.
Yes. I think, Dr. Nimi, there's another question coming, and I think this is a very important hormone that we all are talking about, especially in our everyday life. This is a question by Dr. Baljeet. She's asking, dear ma'am, is there any link between thyroid hormone imbalance and stress?
Yes, indirectly. Thyroid is a hormone which affects the entire body. And these days, I don't know for what reason I'm seeing thyroid ailments and inadequacy of thyroid very commonly. So, thyroid is a gland which is here. It produces a very small quantity, the T3 and T4, which is the two forms of thyroid. If that gets deficient, then TSH rises, thyroid stimulating hormone from the hypothalamus. That rises. So we diagnose thyroid problem by seeing the TSH level sometimes. But thyroid affects the metabolism, it affects your periods, your ability to metabolize food, all kinds of functions, kidneys, all kinds of functions from the metabolic perspective, thyroid gland regulates. But not everything is because of thyroid. Stress may not be because of thyroid, but I mean, you're feeling sleepy, your skin is rough, your appetite is less or more, you are not able to lose weight. All these are symptoms of thyroid, but only proven on lab test, not otherwise.
Okay, thank you, Dr. Nimi. There's another question. This is by Dr. Annapurna Prushti. ये पूछ रही है, is hormonal therapy a way to cope with stress? Is hormonal therapy a way to cope with stress?
No. In fact, hormone therapy, if we have to give for any ailment like PCOD or even for oral contraceptive thing to prevent pregnancies, that brings stress with it. So hormones cause stress. Stress is not cured by hormones. No.
Okay, thank you, Nimiji. There's another question by Priyanka Chanana Sahni. Dr. Priyanka, पहले तो वो I'm also getting these reactions. Thank you, Dr. Nimmi, for this wonderful, informative talk. Dr. Priyanka कह रही हैं, ma'am, what is the relation between stress and gut health? Does menopause also impact gut health, further leading to stress? So she's talking about stress and gut health. Does menopause also impact gut health, further leading to stress?
Very good question. I'm glad somebody asked. I'm not an expert on gut health, but these days they say that gut health is so important that from everything, from your heart health to your, uh, prevention of cancer to your fertility, everything is related to your gut. They are saying to an extent that gut has its own neurons, it has its own intelligence. So gut health is important, but if there is stress, it can worsen your existing gut problems like irritable bowel syndrome, IBS, or like Crohn's disease, ulcerative colitis, or diarrheas. People have, like little bit of anxiety, they go to the washroom. So there is a link between stress, cortisol levels, and gut motility, I must say. So stress and gut, yes, definite conspiracy going on between the two of them. One thing leads to another, and another aids to this one. So keep your gut healthy. Your stress levels will be low. Keep your stress levels low. Your gut will be healthy.
या थैंक यू आई थिंक इसी से जुड़ा एक मेरा ऑब्जर्वेशन है या सवाल आप कह सकती हैं कि स्ट्रेस इज Yeah, definitely you're talking about the female perspective, the gynecological perspective, because it's your specialization. But I would want to know, since we have some male participants also here, that how do you, how, I mean, have you had any case or anything you want to share where you've seen that the male counterpart is more understanding, or how do you try to counsel the male counterpart for managing the stress that the female is facing, the female spouse? So maybe कुछ pointers अगर या कुछ आप share करना चाहें इस पे लेकर.
Mubin, I just wanted to say this only. Dr. Nimmi, in the beginning, you said that this is mainly for women, but I think men should be equally sensitized. They should
Yes.
be made aware of the changes that their wife is going to undergo during certain things. They need to be, but in most of the cases, they are not aware. If the wife behaves in a different manner, they take it otherwise. They are not aware of that. So I think
Yeah.
lectures should
Yes,
be for them as well.
yes, थोड़ा सा, क्योंकि you know, Dr.
हाँ,
Nimi, why I'm saying this कि क्योंकि you deal, obviously the both the husband wife both must be coming to you, so maybe what kind of guidance you can give that you know, you must have given, you must have counseled the men also coming, so what kind of counseling do men also need? ऐसा तो नहीं है वो भी hormonal, if somebody is going to become a father, the father is also facing some hormonal tension या happy hormones या जो भी है, तो वो थोड़ा सा अगर आप हम लोग को रोशनी डाल सके उस पे.
Absolutely. Both are made of the same flesh, same blood. It's just that some organs are different, but 80% of the hormones are same in both of them. So, and men make important integral part of a woman's ecosystem. So obviously, it goes without saying that if they understand the physiology, a woman is able to cope up better. These days people say that we are pregnant, right? We are pregnant, as in
Wonderful.
if they declare. So that's a very healthy trend because
Yeah.
a baby is made by the effort of two people. So these days we let husbands come inside when we are performing cesarean section or conducting a delivery for them to witness this and also increase the confidence of the woman. And it is a very happy moment. We are very happy to counsel them together. Even paternity leave is encouraged by us because it's a journey that both of them undertake. So men should be equally strong. And you see, I mean, you spend your days and nights with somebody who's stable, strong, secure, confident, then you also turn to become like him.
Right.
So it goes without saying that both men and women need to manage their stress. And if they do it together, it's easier. Trust me, there are certain couple activities and goals. If they do it together, it's fun, it's economically effective, and it's
Yes.
very, very result oriented. So, yeah, all for it.
Yes, thank you. Thank you, Dr. Nimi. I'll just take some questions and some comments that are coming. Yeah, since you are an infertility expert, this I think this must be an important question. This is by Dr. Anupriya Roy. Dear ma'am, infertility issues nowadays causes stress, but can it be taken otherwise that infertility is caused by stress? Uh,
Good question, Anupriya.
yeah.
Infertility is contribute. I mean, the stress is a big contributor for infertility. So, as I mentioned, the hypothalamic pituitary axis. So, hypothalamus acts on pituitary, pituitary acts on the ovaries. So, at the time of ovulation, say about 8 to 10 hormones are at play. So, if you are stressed, or mostly when you are expecting to get pregnant and it doesn't happen, so all the time you are stressed, so ovulation is also affected. We always tell I tell to my clients, whoever have come for trying to have a baby, not having a baby, so we start minimal treatment and we ask them, go take a break, move away from your existing ecosystem, go to some other place, spend some time, you know that relaxes woman's mind, and that leads to better ovulation. At least 6 out of 10 of such patients of mine, they end up conceiving. and they end up thanking me. आपने बोला आप छुट्टी पे जाइए, so it worked. So you can
Yeah.
imagine, yeah.
Yeah, that's right. I think that was a very important question, and it affects both the male as well as the female. I think Dr. Ruchika has raised her hand. Valjit ji, can you unmute Dr. Ruchika Sharma?
Sure, ma'am.
Uh, Meanwhile,
Thank you so much, Mubin. Am I audible?
yes,
Yes,
yes, Dr. Ruchika, please go ahead. Please ask your question.
Thank you, Dr. Nimmi. Thank you so much for a great talk. And as somebody, and Mubin is also somebody who works on sexuality and female body as a historian, so do I. I work on sexuality and sexual violence historically as well. I agree with you on I think most of the points, but not on the points of menstrual leave and on maternity leave. हम लोग जो कितने दिन से अब बात कर रहे हैं 1 जुलाई से, एक हमने चीज रियलाइज की है कि रेजिलियंस, बहादुरी कोई तमगे नहीं है. वी नीड पीस, वी नीड शांति, वी नीड स्लो डाउन. वर्क एफिशिएंटली करने के लिए ये सब बेहद जरूरी है. तो इसी के अंतर्गत इफ आई टॉक अबाउट मैटरनिटी लीव, हमारे पूरे विश्व में औरतों ने अपने अधिकारों के लिए, पुरुषों ने भी औरतों के अधिकारों के लिए जहां मांग करी है, वो इसीलिए किया है दैट women कैन बी इक्वल इन वर्क फोर्स विद men. तो women should not have to have the option कि मैं बच्चा करूं कि मैं नौकरी करूं. सो मैटरनिटी लीव है नाउ, तो पैटर्निटी लीव भी मिल रही है विच बेनिफिट्स एन एंटायर फैमिली. आपने बहुत अच्छी बात कही कि आप बोलते हैं लोग वी आर प्रेग्नेंट, तो वहां पर पैरिटी आनी चाहिए. तो आई थिंक मैटरनिटी लीव मिलने से औरतों का करियर, एम्बिशन, देयर रोल, एवरीथिंग दैट women डू, आई थिंक वो और चमक जाता है, निखर जाता है. और दूसरी चीज मेंस्ट्रुअल लीव की बात जहां तक है, रिसर्च अब ये कहती है कि बहुत सी औरतों को जो पेन होता है मेंस्ट्रुअल पेन, वो हार्ट अटैक के बराबर होता है. तो शायद अगर हम इसको नकार देंगे, इफ वी स्टार्ट निग्लेक्टिंग दैट, यू नो, इफ अ वुमन genuinely, I mean, as a growing up person, when I was a teenager, my pain used to be so bad, I could not go to school, I had to take a leave. सो एंड फिर क्या होगा कि धीरे धीरे बात होगी कि जिस औरत को यकीनन दर्द हो रहा होगा, हम बोलेंगे अरे बहाना कर रहे क्योंकि दूसरी औरतें तो बहुत बहादुर हैं. तो शायद रेजिलियंस और बहादुरी के साथ साथ हमें सामाजिक जो रोल है इन अधिकारों का, जो बहुत सोच समझ करके उनकी मांग, आई मीन, आई नो यू आर सेइंग इट एज अ डॉक्टर, आई एम सेइंग इट एज अ डॉक्टर ऑफ हिस्ट्री एंड जेंडर. So I would really like to agree with you, maybe 80%, 20% as a historian. I would want to disagree with you with all due respect. Thank you so much.
Thank you, Ruchika. Dr. Nimmi?
Yeah, I mean,
आपको आपका वो आपका ऑडियो बंद है, डॉक्टर निमी.
so it's healthy to agree to disagree, but
Right, right.
individually, personally, I feel that even if the person is having pain, by staying at home, it will not ease off. She'll have to take professional help if it is such pathological pain which is incapacitating her. And life is short in the sense that if in the reproductive age of 40-45 years, if we take say about every month 2 days, 3 days, 4 days off, I mean, I'm of that competitive bent of mind saying, where is the time left? I mean, as it is, and a woman's body is not fragile. Uh, we are very strong. I mean, trust me, we are strong. So, work on your general health, like anemia, like calcium, vitamin D, B12.
Yes.
Taking rest is no solution, to my
I
mind.
think,
With
yeah,
great
I
respect.
think since Ruchika mentioned about sexuality and gender history, let me just add here that Dr. Nimi in no way was trying to defend that women should not ask for their rights and the fights that we have been asking and the issues that we have been fighting for. She was just talking about the physiological, the medical perspective of it. And I think she very rightly has said here that. कैल्शियम नहीं होता है औरतों के पास. मिया, मुझे याद है कि अगर आप सिर्फ पालक का साग खाएं, है ना, सो women आर डिनाइड द बेसिक हेल्दी डाइट ऑल्सो. मैं एक यहाँ पे बताना चाहूंगी डॉक्टर निम्मी, मुझे हमेशा तकलीफ होती है, मैं कुछ पुरानी फिल्में देखती हूँ, उसमें देखती हूँ कि माँ जो है वो सबको खाना खिलाती है, फिर वो खाने का बर्तन खोलती है, she is, that act of hers that she's just drinking water and going to sleep is celebrated. So yes, well, Ruchika, you're right on that perspective, that we should not celebrate the lack of rights that women are fighting for. But yes, what Dr. Nimmi was trying to say was the medical perspective of taking care of your health, taking proper medical attention, going and seeing a doctor like Dr. Nimmi who would help us. And how many of us are doing regular medical checkups? So it's important that if we want to be in the race, we also have to take care of our body along with our mental health to take to be there. Anyway, so yeah, I'm sorry, I'll just continue with the questions. Dr. Nimmi, this is Dr. There is Dr. Nimmi, there is sorry, just give me a minute. Yes, this is Dr. Bhagat Singh Bakuni. He has some comment. I mean, you can just. Ma'am, I follow Padam Vibhushan Dr. B.M. Hegde lectures. He used to mention there is nothing called as stress. So this is one of the comment that Bhagat Singh is making, that Dr. Hegde says there is nothing called stress. Vikas Sharma ji कह रहे हैं, ma'am, are stress and depression synonymous? If not, then how to differentiate between stress and depression? This is Dr. Vikas Sharma's question.
So stress is a response to any challenge the body perceives. That is the overarching concept. Stress can lead to anxiety. Anxiety can lead to more anxiety. And then, if the happiness hormones dip, or we are genetically prone to depressive illnesses, then it may lead to mild depressive illnesses. Otherwise, stress is not interchangeable with depression. Depression is a complete pathological entity with its diagnosis management clearly defined.
Thank you, Dr. Nimi. There's another question. This is a technical question, technical medical question by Neha Singh. She's asking, Dr. Nimi, could you talk a little bit about premenopause? For instance, how do we sense symptoms for this?
Okay, premenopausal phase, the normal age of menopause is 46 to 55 years of age. But 1 to 2 years before the onset of menopause, which means not having periods for a year, so only then we classify a woman as total menopausal. उससे पहले we label them as pre or perimenopausal. This is the phase which is most annoying because your estrogens are drying up, your ovaries are slowly and gradually shutting its factory inside, and your uterus is getting smaller, and your periods are also going haywire. So the normal reactions to dipping in the hormones is again anxiety, increased signs of aging and dry vagina, not having sexual libido, hot flashes, which is a very peculiar symptom and very, very annoying because the thermoregulator in the body of ours is dependent on estrogen. So your ability to control temperatures or behave in a way that goes for a 6. So suddenly you're feeling hot, then you're having sweating, and that is a very annoying symptom, and there are some prescription medicines for this. Otherwise, menopause, some people have very smooth menopause, that this month they had cycles, next month no cycle, no symptom. Some people go through hell. So it is to each her own. So if you are having fibroids or polyp or cyst, your uterus will give you problems. So regular checkup is important. Managing your weight, your blood pressure, and your blood sugar if you are a diabetic, that also is very, very important. Staying active, eating nutritious diet, having a good cheerful attitude, meeting friends, all this helps in allaying the anxiety around menopause. So these days you will not even realize that the woman sitting next on the table in a restaurant is a menopausal. These days, menopausal women look as young as 30 years, 35 years. So it's just one of the stages. It does not change anything. Just that you can't bear babies. That's it. And that's like, and you don't have to use contraceptives. So it's like liberty. It's like feeling liberated. So I always tell them, please improve your perception of menopause. It's just a very good phase about to happen.
I have a very interesting I mean I this is just एक सोच है एक थोड़ा सा the society, these are very physiological and medical perspective that a woman body is going to go through, but it is what the society and the social agency and everything that makes it more difficult, you can say, for a woman. Now my question, Dr. Nimmi, is that there is no such kind of stress factor for a man who is aging, you see, and whether he has to look good, his look has to look, but with the changing scenario in the medical fraternity that we are seeing, I'll come to the point that you said, we the recent case that has happened, an actress who just died at the age of 42. So I want to know that how does this affect, like you very rightly said, that if we are taking any hormonal medicine or hormonal guidance from the doctor to enhance our beauty or age or something, so what do you feel that is this equal, is this like same for the man as a woman, because the society is not, the social structure is not equal.
Yeah.
हम physiologically देख रहे हैं. I'm very glad that you're saying again and again, and you're imposing on the factor that we are resilient and we are strong, but the society doesn't take it like this. So how do you uh,
So
cater that conflict?
these are the stereotypes that have been ingrained in our minds, right? Men also go through aging and something called andropause, just that their testicles remain active, so they do ejaculate, and mostly they have, unless you have an erectile disorder, they are able to perform their sexual function, and they can even make a woman pregnant, while a woman stops producing eggs. So this is the only difference. Aging process is same. Sexual drive, some menopausal women actually face a surge in sexual drive. वो बात अलग है कि वजाइना ड्राई है, उसके लिए भी रेमेडीज हैं. बट हाँ, देर इज डिस्टिंक्ट डिफरेंस बिटवीन अ मैन्स फिजियोलॉजी and a woman's physiology. But it is not that bad that a woman is completely at disadvantage and man is completely at advantage. No, no. They start getting this prostate gland enlargement, and that sometimes lead to surge in libido, which is pathological. So they have their own set of problems. So aging is actually, we have to crack this how to not age, which seems impossible to me. But you should embrace it like anything.
Yes, yes. I think that is more of a social perspective. Thank you, Dr. Nimi. I'll just take some more questions. There's this question coming from Sachin Kumar, Dr. Sachin Kumar. I'll just read it out. We often hear that women are better at expressing emotions and thus managing stress. As a man from a technical field like electronics, I have noticed that we are conditioned to solve problems, not feel them. Do you think the way men are wired or trained to suppress emotions contributes more dangerously to chronic stress than we acknowledge? And how can a logic driven mind learn to process stress without always trying to fix it? This is a wonderful question.
You
Thank you,
have very
Sachin ji.
intelligent audiences sitting in the gallery. Thank you so
Yes,
much
yes.
for asking. I cannot really justify the quality of answer because my knowledge is also limited. But let me tell you, yes, a woman's body is different. Her mind is different. That touchy, feely, sensitive phase of a woman and very labile phase. That's to some extent it's hormone driven. To minute extent, it's just perception. So there are some girls are not as sensitive. They mean business. They are as clinical, as cut
Yes,
and dry,
yes.
as clear in their thinking. So it is also to do with upbringing, your ecosystem, your intellect, etc. But if you suppress emotions, it does take a toll on both men and women. Corporate work atmosphere is such that it makes you undergo a lot of stress. So you should have some tricks up your sleeve to bust your stress. It's customized. Everybody has different ways. Like some people play chess, some people drive, or कुछ भी हो सकता है. So, but don't neglect this part. If you keep it in the moderate range, it will work for you. But if you let it go, it will be like a beast, which will be all over you. But yes, you're right. Men take a lot on them.
Yes, thank you, Dr. Dimi. There's another question, and I think this question is important. This is by Dr. Baljit because as parents and as the new age kids around, we all face this. So, ma'am, can you please elaborate on whether excessive screen time in children is linked to hormonal imbalances, particularly mood or growth pattern? This is a very interesting question.
The answer is obvious, yes. Too much of screen time actually causes stimulation in the mind, and it can rob you of your sleep and your ability to, your perceptions can change, your life view can change. So, obviously, the moderation is the key there. Um, Kids should be encouraged to play outside. Physical activity is something very important, which I'm sorry to say, but नहीं हो रही है आजकल. So encourage, if you can do one good thing, just play with them, encourage them, put them in sports. That will automatically take 2 to 3 hours of their day to in the field outside. So just go with them or encourage them. Don't scold them because that's counterproductive. And yeah, don't control your kids' life too much. Just talk to them, communicate with them like friends, and let them see the side of the problem and let's see what they say rather than succumbing to their tantrums.
Thank you, Dr. Nimi. You're correct. You're very right there. There's this question by Kishore Hirakant Agivale. He's asking how to figure out that children are in some stress. Is there any indication? And I think not just children, Dr. Nimi. This is a question that even I think I should be asking you. That is there any pointers or anything that indicates that this person is in stress or is going into depression? Where we can help our friends and so that I want to understand.
So I'll speak in perspective of adolescent girls because that's my expertise. Adolescent girls undergo a lot of stress. So at the time of puberty, and you'll be surprised to know the age of puberty has now shifted to 9 years. Previously, it was
Mhm.
13, then it became 11. Now, if a girl has periods at the age of 9, it is all right. We don't call it abnormal. But a kid having periods, it's too much of a challenge. It's too much of stress. Sure, you should be very supportive, lovable, make her understand what periods are. I'm sure teachers also do. And just talk matter of factly. Don't intimidate her. Like she should not feel threatened. Her world comes crashing down. So just a little bit of parental support, especially father speaking to girl, makes a lot of sense. Also, if your child is withdrawn, not eating, not talking, or hiding things from you, just check whether he or she is not being bullied because school atmosphere sometimes can be very depressive. Just be observant and keep a good communication level. Make them sit at the dining table with you, eat with them, listen to them. That's it. It's as simple as that. You'll come to know. If you are a parent, you'll come to know that your kid is not too good.
Okay. Thank you, Dr. Nami. There is a lot of comments and thanks coming your way for your lecture. And Dr. Sachin has conveyed his thanks for answering his query. There's one question, I think, yeah, Dr. Lata Sati is asking, Meanwhile, Bajit ji, if anybody is raising hand, let me know because I can't see. So
Sure,
just let
ma'am.
me know if anybody raise hand. This is the question by Dr. Lata Sati. I'll just read out. Cancer of uterus has become very common nowadays. What can be the reason for it? Ma'am, can you explain?
Uterus has two parts, cervix and the body of the uterus. Cervical cancer is the most common cancer in women in India. In fact, we are the cancer capital for cervical cancer. Therefore, everybody should be covered by HPV vaccine, which is given to girls between 9 to 16 years of age. So, if you have daughters or female relatives, just encourage them to take HPV vaccine. It curtails the incidence of cancer of the uterus, I mean cervix, by 98%. Endometrial cancer is a different thing. It is more common in those women who've never born children, who've never married, who've had fibroids or endometrial hyperplasia or have been on hormones. So regular checkup, ultrasound, and endometrial biopsy, uh, and certain tumor markers that can be done periodically after 40 years of age. It is not a cancer that surfaces earlier than 35-40, so no need to panic. Regular screening processes will help you. Uh, every cancer is on the rise, so I attribute it to a lot of microplastics and environmental degradation. That is my answer to increasing incidence of malignancy in every part of the body and stress.
Okay, thank you, Dr. Nimi. I'll just read. There are some comments. First of all, Dr. Neha Mishra is saying, thank you, ma'am, for an interesting session. Dr. Trilochan Jina is saying, thank you, madam. I'm just checking if I have missed any question. Yes. There's one question, Dr. Nimi, since uh, we are in the teaching fraternity and all our participants are. Do you think that the profession of a person has something to do with stress? Is it? I mean,
Okay,
I mean, if you're in a particular profession, you're more prone to be stressed. Definitely, there is, but maybe some physiological perspective, if you could tell us.
definitely different type of professions have different professional hazard. Like a traffic cop will have more propensity towards getting the respiratory problems. If somebody is into academic thing, maybe exhaustion, burnout, eye strain, all this will be there. But everybody knows how to manage their work centric stress. There should be antidotes available, and it's from the beginning only you should foresee this kind of stress. So how to negate it, you should know. But that's true for every profession. In our profession also, there's so many hazards, like lawsuits. So I mean, those are different kind of hazards. But yeah, body takes. I mean, any profession takes a toll. But given a choice, I would not lead a life without any expert uh, profession. That's our identity. That's something that we are there for. So take a pride, change your perception towards work related stress, take it in your stride, enjoy. Don't take everything too seriously.
Mhm. There is an interesting comment coming from Dr. Vikas Sharma. I hope I read it correct. वो कह रहे हैं जरा मरणः दुखेन मोहिता बुढ़ापा और मृत्यु के दुख से मोहित हुए हैं क्या ये दुख भी तनाव का एक कारण है ये डॉक्टर विकास शर्मा जी हैं उनका
This is
प्रश्न है
so deep. ये तो बहुत गहरी बात कह दी है उन्होंने. बुढ़ापे और मृत्यु से डरना नहीं चाहिए.
हाँ
Duke or Tanav. I mean, it's just a journey. Nobody's here permanently. So इसमें कोई बहुत ज्यादा गहरा स्पिरिचुअल वो नहीं है एवोल्यूशन. सबको पता ही है कि आए हैं तो जाना ही है. यंग है तो बूढ़े भी होना ही है. बट enjoy every stage. I
yes
have a very healthy attitude towards life.
That's beautiful. That's a very positive and a beautiful perspective put forth by you. I'll just read some comments. ये शबनम सिंह राणा है, ये लिख रही है, very insightful session. Ma'am will try to read your book. Yes, we have shared the cover page of ma'am's book, and they are wonderful. They are on the best-selling thing. Uh, जय सिंह कह रहे हैं, thanks ma'am for this knowledgeable session. Dr. Anupriya Roy is saying excellent session ma'am. डॉक्टर निम्मी, एक सवाल जहन में आता है मेरे, मैं वो आपसे पूछूं, और मुझे लगता है जब तक कोई और पार्टिसिपेंट, हाँ विकास शर्मा जी भी आपसे कह रहे हैं, धन्यवाद। ये दिस इज लाइक, this is more of related to the geography and the nationality. आप डॉक्टर हैं, आप ट्रैवल करती हैं, आप इंटरनेशनल फोरम्स पे भी जाती हैं, यू पार्टिसिपेट इन पॉलिसी मेकिंग. What is it that is a plus factor for us Indians when it comes to stress management? Do you think there is a plus factor which we should enhance and understand as Indians? जैसे हमें अभी एक हमारी एक्सपर्ट आए थे सुबह, वो बता रही थी कि कुछ कंट्रीज में हॉर्न देना इज नॉट लाइक, यू नो, हमारे लिए हॉर्न देना, ट्रैफिक, दिस इज अ वेरी कॉमन थिंग. तो हम कहीं ना कहीं रेजिलियंट है, हम नहीं जानते वो स्ट्रेस है, और या हो सकता है वो हमें इफेक्ट भी ना कर रहा हो. Is there any plus factor as Indians or as our social, cultural microcosm that we have that helps as a
So, a good, strong family structure is a plus, and that we are a democracy is another plus. वो बात और है कि उसके pitfalls भी हैं, but yeah, we are happy go lucky. We take care of our elderly. We have joint families. That's a very healthy pattern. I have not seen it in Western countries. So we take care of our kids in the same breath as we take care of our elderlies, and we mostly eat home cooked meals. That's also plus.
Yeah, right. Home cooked meals. I think these are very simple but very important pointers that you have mentioned. And uh,
Another thing, Moby, we have
जी,
good access to medical consultation.
oh,
Overseas, if you want to take a doctor's consultation or a psychiatrist, psychologist, you have to wait for months. I mean, the medical system here little unregulated, but still, you will get to see a doctor if you want in half an hour somewhere,
yes,
or get
right.
any test done. This is like a unthinkable proposition for some people.
Yes, right.
ये हमारी अच्छी चीज है.
I think that's such a blessing that you have made a point on. हम काफी चीजें इग्नोर कर जाते हैं, कुछ ऐसी चीजें होती हैं जो हमारे लिए बहुत इंपॉर्टेंट है, लेकिन हम उसको मानते नहीं है, समझ नहीं पाते हैं उसका इम्पोर्टेंस. दैट्स वेरी नाइस दैट यू मेंशन दैट. डॉक्टर डिबी, एक लास्ट वो है, एक शायद किसी ने क्वेश्चन, या देयर इज वन क्वेश्चन एंड देन वन पॉइंट आई वांट टू आस्क, एंड देन वी विल कंक्लूड बिकॉज वी हैव द नेक्स्ट स्पीकर. ये रजनी जी हैं, ये कह रही हैं, रिलेशनशिप बिटवीन ओसीडी एंड goal accomplishments, since OCD required treatment to rid of, to get rid of. Relationship between OCD and goal accomplishments, since OCD required treatment to get rid of. I think
So
she's, if
OCD
you've
has
understood.
OCD has a range, right? From very very minimal OCD or family genetic links, तो थोड़ा बहुत environmental भी acquire हो जाता है, to very severe OCD which leads to severe anxiety and depression. So if you are in 1/8 of that spectrum, you're good. Some people use their OCD for their advantage. So you should be smart enough to understand your own demeanor, your own nature. And if you come to know that, yes, I am a little bit of OCD, I want things arranged in a certain manner, I want cleanliness, all this is fine. This will work in your favor. But if you go and wash hands 10 times without any reason, germ theory, etc., that is where you're crossing the line. So I don't know whether I'm able to make sense, but yeah, I mean, just make use of your mild OCD towards your gains.
Yes, thank you. How nicely put, Dr. Nimi. And let me just check if we have. So we've shared the cover page of your book. Even the other one, Baljit ji, if you could share the other book,
Sure, ma'am.
Ruptured Boundaries, and the other one also. Yeah, and Dr. Nimi, मैं एक सवाल, I think if there's any no more questions, Baljit ji, or are we getting some questions? Let me check.
No,
Yeah,
ma'am.
Dr. K.
We are
Yeah,
done with the questions, ma'am.
yeah, okay. Dr. Keshri Nandan ji is saying very insightful session, and I'm really thankful for a very sensitive and understanding male participants also who are here, because they've also put very important questions. Dr. Nimi, अगर आप कुछ कोई experience, because we've all been through COVID, and you were part of the task force, and you were you. I know how diligently you've been working in those times, and um, so. As a medical practitioner, as well as a sensitive individual, what do you think that as member of the society, the pandemic में कुछ ऐसी चीज जिससे आप कोई सीख लेके हम लोगों को उससे निकलना था, we should take it, we should learn from that. So would you like to share something?
So, Mubin, as you mentioned, I am running a channel called The Doctor Who Tells Stories. It's on YouTube. So I've narrated this story and I tell them to everybody because that shows that we are also human.
Mm-hmm.
Yes, COVID has changed my worldview entirely. It has changed my lot of things within me. It has cracked few things because I've seen so much of mayhem, clo- so much of tragedy and travesty and irony. So I'm a different person. I was on duty that day. It was in April 2021. That was the time the second wave hit. एंड मुझे तभी कोविड हुआ था 10-12 दिन पहले और डॉक्टर्स की बेहद कमी थी so they used to put us in the consultation room with a screen and we used to do online consultation though we were sitting in the campus of the hospital and sometimes used to go inside if it was a matter required. So I am talking to somebody who's known to me, and this person is saying this is the third day of his illness, and I know that he's downhill. And I'm telling him, सर आप ठीक हो जाएंगे, आपको तो हम छुट्टी करने वाले हैं. और अब मैं पेप टॉक दे रही हूँ बिकॉज उस टाइम मेरे पास देने के लिए और कुछ भी नहीं है. तो ही इज टेलिंग मी इज एन एजुकेटेड पर्सन. ही हैड नेवर मैरिड, उनके कोई बच्चा नहीं था, तो उनको कोई मिलने भी नहीं आता था. इनफैक्ट बाद में भी कोई नहीं मिलने आया उनको. सो ही इज टेलिंग मी, मतलब उनके मुंह पे मास्क लगा हुआ है. पैरामेडिक्स वहां से मुझे कह रहे हैं कि इनकी सांस फूल रही है, इनसे बात मत करो. ही इज टेलिंग मी पेपर लाओ पेन लाओ, समथिंग लाइक दिस. सो आई सेड अच्छा आप कुछ बताना चाह रहे हैं, ओके बताइए. मुझे नहीं पता था वो क्या बताना चाह रहे हैं. उन्होंने मुझे अगले 10 मिनट में अपनी जिंदगी का सार और उनकी जो जीवन भर की कमाई थी उसको वो कहाँ कहाँ देना चाहते हैं वो मुझे एक एक करके बताया. उनको यकीन हो गया था कि वो नहीं बचने वाले हैं, तो वो मुझे अपनी विल बता रहे थे. विल क्या थी कि मेरी एक गाय है जो सनातन मंदिर में आप दान दे दीजिएगा. आई हैव an FD that's kept in the almirah. The key of the almirah is behind the pot, under the pot behind my house. मुझे ये भी नहीं पता वो रहते कहाँ हैं. सो देन ही सेइंग कि आई हैव, मेरी माँ की एक चेन है, वो मेरे भतीजे के बेटे की बहू को जाएगी. एंड मेरा जो घर है वहाँ वो पुलिस ट्रेनिंग स्कूल को दिया जाएगा. वहां पर फ्री ट्रेनिंग देंगे और रेजिडेंस बनाएंगे उन लोगों का जो देश की सेवा करते हैं, बिकॉज वो खुद आर्मी से थे. उन्होंने मुझे बहुत सारी चीजें बताई. और उसके बाद मैं उनसे कह रही हूँ सर क्या कर रहे हो, हम तो अब आपको अगले कल डिस्चार्ज कर देंगे. और मैं अंदर से माय हार्ट इज पाउंडिंग फास्टर बिकॉज मुझे तभी कोविड होके चुका था. आई वाज नॉट स्ट्रांग. एंड देन व्हेन आई लुक डाउन, मैंने कुछ भी नहीं लिखा था, एक शब्द मैं नहीं लिख पाई. आई वाज सो ओवरवेल्म्ड. नेक्स्ट 4 आवर्स में जब दोबारा राउंड हुआ, ही वाज नो मोर. उनका बेड पे कोई और पेशेंट था. So till date, I cannot forgive myself कि मैं उनका टेस्टमेंट, लास्ट विश, ये तो मैं आपको बता रही हूँ, ये मैं अपनी मेमोरी से बता रही हूँ. So that is one story that moved me to tears, and I tell this to everybody. This is also part of the channel that I'm narrating the stories. So COVID
Uh,
was a demon that I can never forget.
yes, thankfully,
It's
people
over.
like you, yes, people like you who worked resiliently and they worked so hard, the entire team. So thank you for sharing that very sensitive doctor's tale. And I think I'll just take one last question that has come, Dr. Nimmi. And I know you are a very busy person. You have an OT.
No,
So I'll just leave you. I'll just take one last question. What is the question? दिस इज बाय जय शंकर शर्मा. हाँ, सर पूछ रहे हैं कि मैम हाउ टू हैंडल डाउन सिंड्रोम स्टूडेंट्स इन आवर क्लास. Yes, I think that's a very important question. How to handle Down syndrome students in a class? Actually, maximum time they are very aggressive in behavior.
so there's a proper toolkit and proper advisory issued by ministry for handling such cases, because इनका भी spectrum होता है from mild to moderate to very severe. So there's a whole guideline. When I was part of that advisory on government GNCTD, I saw that the differently abled and even दिव्यांग, इन सब के लिए गवर्नमेंट ने बनाया हुआ है. So it's not easy, but NGOs are doing good job. I know one Shaurya Foundation, then Adi, and then Spastic Society of India. I'm sure this is not my area, but yeah, I know what you're saying. It's a very difficult job, but we have to include them in the main line. I mean, we can't leave them behind. We have to put them in schools, complete their education. That's all
Yes,
I can say.
that's yes. Thank you, Dr. Nimi. That's a very beautiful thought and a very concerned thought. I think, yeah, I'll just read some comments, which I'm sure it's important to convey to you, Dr. Nimi.
जी.
Amit Kumar ji keh rahe hain, one of the best sessions till now, and uh, very insightful session. And they're looking forward to reading your book. Rohit Kumar ji keh rahe hain, ma'am, your session was very enlightening and thoughtful. And I think on that note, uh, I would like to thank you, Dr. Nimi. सबसे
Many
पहले तो
thanks.
मैं
I also learned a lot of things.
no
How
no
men think.
no because I know you the work that you have been doing and the kind of a positive personality you are, and we need more people like you because I mean I will not go into that kind of a debate of the medical fraternity because ये सब पढ़ा लिखा मजमा है, they are all learned people and they know, but the perspective and the thought that you're putting in your profession, I hope and I pray that we have more people like you. With that note, Dr. Nimi, I, on behalf of Atma Sanatan College and then and Ramanujan College and the entire team of this refresher course, and let me tell you, Dr. Nimi, our principal sir is here, Professor Gyantosh Kumar Jha sir. मैंने उनको जब मैंने आपसे बात की थी तो मैंने उनको बताया था कि because you appreciated that somebody is like you said in the beginning also that at least some people are thinking on this and academics are doing something on stress management. So let me tell you that this was the initiative of our principal. He made it a point that we do a refresher course that covers the various paradigm of this topic of stress management, and I'm glad that you could give us the medical perspective, the hormonal perspective जिसको हम समझते हैं कि एक सोशल और मेंटल इलनेस की तरफ से तो है, लेकिन एक मेडिकल पर्सपेक्टिव आपने बहुत अच्छे से समझाया कि इट्स ऑल अबाउट hormonal issue also, keeping in mind your expertise as a medical expert. Mm, so डॉक्टर निम्मी, मैं ये कहना चाहूंगी कि आपने हमें मोबाइल रहने का के लिए बताया, हाइड्रेशन का इम्पोर्टेंस बताया, मेडिटेशन और मेडिकेशन दोनों के इम्पोर्टेंस बताए, एंड देन ऑल्सो some very important things like women, girls from the 9 year, from age of 9 to 16 years, they should be given vaccine, HPV vaccine. So, and also, you spoke about the celebration of being resilient, not on the social perspective, but on the perspective of as an individual, that we have to be resilient. And uh, also, you spoke about the good family values, and also democracy that we live in, then also the importance of home cooked meals. That so these to be if I try to be crisp and try to understand this wonderful lecture of yours, I would say that you have given us a very micro understanding of a macro issue, and in a very short time you have tried to explain to us all that. Dr. Nimmi, I what took away from your lecture was that it's very important, like what you said, and I really appreciate that, and I think all my fellow participants here would have understood and would appreciate that anything your body not requires is like abusing your body. So that is very important for us as individuals to understand. So on that note, Dr. Nimmi, I would like to thank you on behalf of our principal, Professor Gyantosh Kumar Jha, all the participants here who are sitting since 10:30 in the morning and are actively participating. At present, we have 204 participants, Dr. Nimmi, and they all are actively there. And I thank you on behalf of my entire team. Professor Vinita Tuli, आपने उनको सुना था बीच में, she's our IQAC in charge, and she also made an observation. And Dr. Anjali, Professor Anjali, and my entire team, my tech team, Dr. Baljit, she's there. So on behalf of all of us and on behalf of all the participants, I'd like to thank you, Dr. Nimi, for taking time out. And I know you are in and out. You're अभी भी आप अपने clinic में हैं, and I know you've been attending your patients and you have an OT. Thank you so much for coming, taking time out and speaking to us on the topic hormone-induced stress, Boon or Bane, stress, a double-edged sword. Thank you so much, and it's really been wonderful. You can already see the.
Yeah.
Thank you, Dr. Nimmi, and I wish you well, and I wish you all the very best. We need more people like you. Thank you. बहुत बहुत शुक्रिया आपका.
Okay.
Thank you, Dr. Nimi.
Bye bye. Thank you.
Okay, bye bye.